Good evening, one and all. We welcome you all to the International Conference on Suicide Prevention, Awareness, Education, Health, Well-being, Environment and Sustainable Development 2024, commemorating Azadi Ka Amrit Mahotsav, nation celebrating 77 years of independence and United Nations Sustainable Development Goals 2015 to 2030 as part of awareness and campaigns. And also, on occasion of World Suicide Prevention Day, World Suicide Prevention Week, and World Suicide Prevention Month 2024, which is celebrated on September every year in collaboration with Sri Holistic Health Foundation India and Sri Research Institute Center for Art, Sciences and Wellbeing, and international and national fraternity. Before we start our sessions, let's take the blessings of Almighty. And in the meanwhile, presenters who have registered for their presentations can share your details in the chat box as displayed on the screen so that we can invite you as per the given order.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
With the blessings of Almighty, we shall continue with today's commemorations and sessions. We'll first initially take up commemorations. In the meanwhile, the presenters can share their details in the chat box if they are available. Then we'll move on to sessions on suicide prevention. Today, as this is also very much related commemoration for today is also commemorated as International Translation Day. See, suicide and translation also, are very closely related to each other, as suicide is an universal phenomenon. We need to reach out to people who are committing suicide for suicide prevention and also rehabilitation. So, across the world, we have different languages. We need to communicate through oral, written, verbal, non-verbal communication. And especially, there are little challenges when compared to non-verbal communication, the major challenges being customary and traditional, which differ from cultures and traditions and belief system. And the other major challenge with verbal communication is the language which is used. So today, as a coincidence, we are also having, the language professionals being celebrated today on occasion of International Translation Day, where they can play an important role in translating the messages or the counseling, the therapeutic literature, which is very much helpful for suicide prevention and suicide prevention awareness, and so on. So let's look at the commemorations of the day, which today we are celebrating International Translation Day on 30 September every year. The Universal Declaration holds the Guinness World Record as the most translated document It exists in more than 500 languages. The United Nations is one of the world's largest employers of language professionals. There are 6 official languages of the UN: Arabic, Chinese, English, French, Russian, and Spanish. These are the 6 official languages of the United Nations. A delegate may speak in any official language. The speech is interpreted simultaneously into the other official languages of the United Nations. So, the role of language professionals on International Translation Day is meant as an opportunity to pay tribute to the work of language professionals, which plays an important role in bringing nations together, facilitating dialogue, understanding, and cooperation, contributing to development, and strengthening world peace and security. Transposition of a literary or scientific work, including technical work from one language into another language, professional translation, including translation proper, interpretation, and terminology, is indispensable to preserving clarity, a positive climate, and productiveness in international public discourse and interpersonal communication. Thus, on 24th May 2017, the General Assembly adopted Resolution 71 by 288 on the role of language. Professionals in connecting nations and fostering peace, understanding the development, and declared 30th September as International Translation Day. Why 30th September? You might be wondering why 30th September has to be chosen. So 30th September celebrates the feast of St. John, the Bible translator, who is considered the patron saint of translators. St. Jerome was a priest from northeastern Italy who is known mostly for his endeavor of translating most of the Bible into Latin from the Greek manuscripts of the New Testament. So he also translated parts of the Hebrew Gospel into Greek. He was of Iranian ancestry and his native tongue was Iranian dialect. He learned Latin in school and was fluent in Greek and Hebrew, which he picked from the studies and travels. Journey died near Bethlehem on 30 September 420. So multilingualism is the core value of the United Nations. Languages with their complex implications for identity, communication, social integration, education, and development are of strategic importance for people and the planet. There is growing awareness that languages play a vital role in development, in ensuring cultural diversity and intercultural dialogue, but also in attaining quality education for all, strengthening cooperation, in building inclusive knowledge, societies, and preserving cultural heritage, and in mobilizing political will for applying the benefits of science and technology to sustainable development. An essential factor in harmonizing communication among peoples, multilingualism is also regarded by the United Nations General Assembly as a core value of the organization. By promoting tolerance, multilingualism ensures effective and increased participation of all in the organization's work, as well as greatest effectiveness, better performance, and improved transparency. The United Nations is one of the world's largest employers of language professionals. Several hundred language staff work in UN offices in New York, Geneva, Vienna, and Nairobi, or at the United Nations regional commissions in Addis Ababa, Bangkok, Beirut, Geneva, and Santiago. Translators are one type of language professionals employed at the UN. UN language specialists include editorial and desktop publishing assistants, editors, interpreters, precise writers, production editors, and desktop publishers, translators, verbatim reporters. So there is a lot of opportunities if you are very much fluent and conversant in any one or more languages. United Nations translators handle all kinds of documents, from statements by member states to reports prepared by expert bodies. The documents they translate cover every topic on the United Nations agenda, including human rights, peace, and security and development. New issues arise every day. UN documents are issued simultaneously in the 6 official languages of the organization: Arabic, Chinese, English, French, Russian, and Spanish. Some core documents are also translated into German. This multilingual documentation is made possible by the United Nations translators, whose job is to render clearly and accurately the content of original text into their main language. Interested in working as language specialists in the United Nations? You can check UN carriers on competitive examinations for language professionals. You can also part of the larger UN team of translation professionals. Translation is often the essential prerequisite for accessing a universal, multiple, diverse culture. It's in this issue of UNESCO Courier explores what this reality entails. And there are also, like I have mentioned, we have been discussing that there are official languages of United Nations, which are 6 in number. So every day is also celebrated for each language. A dedicated day is celebrated as Language Day. For example, 21st February is celebrated as International Mother Language Day, 20th March as French Language Day at the United Nations, 20th April, Chinese Language Day at United Nations, 23rd April, English Language Day at the United Nations, 23rd April, Spanish Language Day at the United Nations, and 5th May as World Portuguese Language Day, 6th June, Russian Language Day at the United Nations, 7th July, World Kiswahili Language Day, 18 December, Arabic Language Day at United Nations, and the entire decade of 2022 till 2032 is the International Decade of Indigenous Languages. We'll just watch a short video. In the meanwhile, you can check the format in the screen. Those who have registered as presenters, they can share their title, full name, occupation, it is designation, organization, and the place and duration of your presentation in the chat box so that we can invite you at the appropriate time. That is only for the presenters. Participants need not share. They can fill the registration form and feedback form to be eligible for their certificates. Today, there is also one more relevant day where we can appreciate the role of communication and languages. Today is also commemorated as International Podcast Day. Radio has been there since 18th century and is so 20th century. The world has long moved on from the world of radio and into the world of podcasting. A forced marriage between iPod and broadcasting lead to creation of the word. And while the iPod has long gone extinct, its namesake form of media is here to stay. Podcasts have fundamentally changed the way people consume audio, and for that reason, we celebrate on September 30, here's to International Podcast Day. With apps like Pocket Cast for Android and Downcast for iOS, it's never been easier to find an interesting podcast. Browse by category or by popularity, and you are bound to find at least a dozen that you will have a hard time turning off. You can create your very own podcast, and you are likely already got the tools you need to get started. Between your mobile phone and your computer, you are likely got a microphone and some apps like GarageBand or Audacity. Recording the podcast is easy part. The real challenge comes when you are trying to pick a topic worth listening to. Many of the popular podcasts survive on minimal ad revenue and donations from viewers like you. As much as even hearing those words can put one to sleep, they are the reason, and they can also save lives by bringing them the ray of hope, motivation to live and to face the challenges and to lead the life further, accepting the situation and looking for the solutions to overcome it and deal with it. So consider throwing a few dollars towards your favorite podcast so that they can keep you on broadcasting once you have gone air with your podcast. If you are into podcast, there are also some good news. They are almost always free or really cheap. So you'll have to put up with an ad or two throughout your programming, but they are not long and obtrusive like the ones we come to expect on various other media platforms like TV. If you have got a device with an audio output and an internet connection, you can listen to podcast, and it's that easy. And if you have only recently discovered podcast, this one is for you. Unlike your favorite radio shows of yesteryear, the new podcast you discovered likely has an easily accessed library of every episode they have ever aired. So be careful, though the fact that you need to sit still and watch a screen is what keeps your Netflix binging in check. With podcasts, you can listen to them anywhere, so it's easy to get through a dozen episodes and wonder where your day went. They allow for serialized storytelling. While we all have a special place in our hearts for shows like The Wonder Years or Happy Days, episodes were generally self contained and short stories without much room for depth. Many podcasts take their cues from the current television trend of having story arcs that span multiple episodes or seasons. Check out NPR's serial for a listening experience. You won't be able to let it go. So, what are you waiting for? If you are planning to motivate or if you have some thoughts, use the platforms like this to share your knowledge, thoughts, and ideas and your views, perspectives in a positive, productive, and constructive way. And start podcasting today. So today we are moving to our presentations. So the presenters requested to share your details in the chat box quickly. We have Kiruba Lakshmi, our occupation, a student of MSc Clinical Psychology from Ratnam Arts and Science on suicide prevention. Okay. Are you ready, ma'am, for your presentation? Okay. So you are not permitted to do any other activity or closing, opening any forms or anything. If you see any form, you can just minimize the form. Do not close it. Do not end it. You are only permitted to unmute yourself, start your video and share your presentation with your introduction. So we are giving you permission to share. You can start your presentation. Now you can unmute yourself, start your video. Kindly go through the presentation guidelines.
Yeah, sir, sure. Good evening. So I will share my presentation now. So shall I show you in the video itself?
You don't have any PPT, ma?
Yeah, sir, but it's not allowing to me to show that.
You can click on share button. First
Yes,
open PPT in your mobile. You are using mobile or laptop?
mobile, sir.
Okay. You can open your PPT in your mobile.
Okay, sir.
Have you opened it?
Just a minute, sir.
Have you opened it, ma?
So it's not allowing to me.
No, you already have the permissions, no?
So yeah, but it's not for. It's not. I'm having WhatsApp, so I can't able to share it.
No, you have to first open it, ma, in your mobile. Can you see PPT in your mobile?
That's what I have separate mobile to for PPT, sir.
Then you have to log in from that mobile also. You join Zoom session from that mobile also.
Yeah, sir. Okay.
Have you logged in, ma? In the meanwhile, any other presenters willing to share their presentation can share your details in chat box. We can invite you next. Lakshmi, are you there? Okay, you can join from two mobiles, and you can use one mobile for audio and video and other mobile for sharing your PPT. So take your own time. Once you are ready, you let us know. We'll move on. So we'll see why this suicide prevention day, how it evolved and emerged, and why this is celebrated. When we look back, World Suicide Prevention Day is celebrated every year on 10th September 2024, with the theme for 2024 is changing the narrative on suicide. So suicide is a major public health challenge with more than 7 lakh deaths each year globally. Each suicide has far-reaching social, economical, and emotional consequences and deeply affects individuals and communities worldwide. The tri-annual theme for the World Suicide Prevention Day for 2024-2026 is changing the narrative on suicide. With the call to action, start the conversation. This theme aims to raise awareness about the importance of reducing stigma and encouraging open conversations to prevent suicides. Changing the narrative on suicide is about transforming how we perceive these complex issues and shifting from a culture of silence and stigma to one of the openness, understanding, and support. The call to action encourages everyone to start the conversation on suicide and suicide prevention. Every conversation, no matter how small, contributes to a supportive and understanding society. By initiating these vital conversations, we break down barriers, raise awareness, and create better cultures of the support. This theme also emphasizes the need to prioritize suicide prevention and mental health is in policy making. Calling for government action, changing the narrative requires advancing for policies that prioritize mental health, increase access to care, and provide support for those in need. World Suicide Prevention Day, WSPD, in short, was established in 2003 by the International Association for Suicide Prevention in conjunction with the World Health Organization, WHO. The 10th September each year aims to focus attention on the issue, reduces stigma, and raises awareness among organizations, governments, and the public, giving a singular message that suicides are preventable. So when we look at suicide, what is suicide? And how many people are dying? What is the magnitude of suicide? So as we have already seen, more than 7,20,000 people died due to suicide every year. Suicide is the third leading cause of death among 15 to 29-year-olds. 73% of global suicides occur in low and middle income countries. The reasons for suicide are multifaceted, influenced by social, cultural, biological, psychological, and environmental factors present across the life course. For every suicide, there are many more people who are attempting suicide. Every year, suicide attempt is an important risk factor for suicide in the general population. Every year, 7,26,000 people, even more people, take their own life, and there are many more people who make suicide attempts. Every suicide is a tragedy that affects families, communities, and entire countries and has long lasting effects on the people left behind. Suicide occurs throughout the lifespan and was the third leading cause of death among 15 to 29-year-olds globally in 2021. Suicide does not just occur in high income countries, but in global phenomenon in all regions of the world. In fact, close to three quarters, 73% of the global suicide occurred in low and middle income countries in 2021. Suicide is a serious public health problem that requires a public health response. With timely evidence-based and often low-cost interventions, suicide can be prevented for national response to be effective. A comprehensive multi-sectoral suicide prevention strategy is needed. Now, who is at risk? How to identify the vulnerable population? The link between suicide and mental disorders, in particular depression and alcohol use disorders, and different addictive and substance abuse, and a previous suicide attempt is well established in high-income countries. However, many suicides happen impulsively in moments of crisis with a breakdown in the ability to deal with life stresses such as financial problems, relationship disputes, or chronic pain and illness. In addition, experiencing conflict, disaster, violence, abuse, or losses, and a sense of isolation are strongly associated with suicidal behavior. Suicidal rates are also high among vulnerable groups who experience discrimination, such as refugees and migrants, indigenous peoples, lesbian, gay, bisexual, transgender, intersex, LGBTI persons, and prisoners. Now, how do we prevent and control? When coming to prevention and control, there are several measures that can be taken up at population, subpopulation, and individual levels to prevent suicide and self-harm. Live Life, World Health Organization's initiative for suicide prevention, recommends the following key effective evidence-based interventions. Limit access to the means of suicide like pesticides, firearms, certain medications. Interact with media for responsible reporting of suicide. Foster socio-emotional life skills in adolescents. And early identify, assess, manage, and follow anyone who is affected by suicidal behaviors. The need to go hand in hand with the following foundational pillars like situational analysis, multi-sectorial collaboration, awareness raising, capacity building, financing, surveillance, and monitoring and evaluation. Suicide prevention efforts require coordination and collaboration among multiple sectors of society, including the health sector and other sectors such as education, labor, agriculture, business, justice, law, defense, politics, and the media. So these efforts must be comprehensive and integrated given the multifaceted nature of suicide. There are also certain challenges and obstacles in suicide prevention and awareness. Stigma and taboo. Stigma, particularly surrounding mental disorders and suicide, means many people thinking of taking their own life or who have attempted suicide are not seeking help and therefore not getting the help they need. The prevention of suicide has not been adequately addressed due to lack of awareness of suicide as a major public health problem and the taboo in many societies to openly discuss it. To date, only a few countries have included suicide prevention among their health priorities, and only 38 countries report having a national suicide prevention strategy. So, raising community awareness and breaking down the taboo is important for countries to make progress in preventing suicide. Globally, the availability and the quality of data on suicide and self-harm is poor. Only some 80 World Health Organization member states have good quality vital registration data that can be used directly to estimate suicide rates. The problem of poor quality mortality data is not unique to suicide, but given the stigma surrounding suicide and illegality of suicidal behavior in some countries, it is likely that underreporting and misclassification are greater problems for suicide than for most other causes of death. And as we all know, the amount of reported are quite less than those which go unreported, which are even tens and 100 times, sometimes more than actually reported incidents. So globally, the data of the quality of the data or the availability and quality of data on suicide and self-harm is also poor because of these reasons and various other reasons. Only some 80 World Health Organization's member states have good quality vital registration data that can be used directly to estimate suicide rates. The problem of poor quality mortality data is not unique to suicide, but given the stigma surrounding this suicide and illegality of suicidal behavior in some countries, it is likely that underreporting and misclassification are greater problems for suicide than for most of the other cases of death. Improved surveillance and monitoring of suicide and self-harm are required for effective suicide prevention strategies. Cross-national differences in the patterns of suicide and changes in the rates, characteristics, and methods of suicide highlight the need for each country to improve the comprehensiveness, quality, and timelessness of their suicide-related data. This includes vital registration of suicide, hospital-based registries of self-harm, and nationally representative surveys collecting information about self-reported self-harm. The urgency to act to prevent suicides have been recognized and prioritized at the highest levels. The reduction of the suicide rate is an indicator in the UN Sustainable Development Goals, the only indicator for mental health. World Health Organization's General Program of Work and World Health Organization's Comprehensive Mental Health Action Plan 2013 to 2030, the first World Health Organization, the first World Health Organization World Suicide Report, Preventing Suicide, a Global Imperative, published in 2014, aimed to increase awareness of the public health significance of suicide and suicide attempts. To increase awareness of the public health significance of suicide and suicide attempts, and to make suicide prevention a high priority on the global public health agenda. It also aimed to encourage and support countries to develop or strengthen comprehensive national suicide prevention strategies throughout a multi-sectorial public health approach. In 2021, World Health Organization launched Live Life, an implementation guide for suicide prevention in countries. Accompanying resources to support the implementation of the 4 key Live Life interventions have also been published, including the 2024 brochure on preventing suicide by phasing out highly hazardous pesticides to support limiting access to means. Preventing Suicide, a resource for media professionals, update 2023, is to encourage responsible reporting of suicide, and the Helping Adolescents Thrive Toolkit to foster socio-emotional life skills among young people. At the health sector level, the suicide self-harm is one of the priority conditions in which World Health Organization Mental Health Gap Action Program, in short known as MHGAP, which provides evidence-based technical guidance to scale up service provision and care in countries for mental, neurological, and substance use disorders. The MHGAP Intervention Guide, in short known as MHGAP IG, includes a specific module for suicide and self-harm to support early identification, assessment, management, and follow-up. Through the Live Life initiative, governments are encouraged to implement a suite of evidence-based interventions and foundational pillars of suicide prevention. Every year, we can see, and every 40 seconds, a person dies by suicide somewhere in the world. Over 8 lakh people die suicide every year, yet suicides are preventable. Preventing suicide, a global imperative, which has been already discussed, is the first World Health Organization report of its kind, which aims to increase awareness of the public health significance of suicide and suicide attempts, to make suicide prevention a higher priority on the global public health agenda, and to encourage, support countries to develop or strengthen comprehensive suicide prevention strategies in a multi-sectorial public health approach. The report provides a global knowledge base on suicide and suicide attempts, as well as actionable steps for countries based on their current resources and context to move forward in suicide prevention. All these resources are very much useful. Which will help you to address these suicidal issues, suicide prevention and suicide prevention awareness. As we have seen that more than 8 lakh people losing their life to suicide every year, the world is not on track to reach the 2030 suicide reduction targets. World Health Organization advocates for countries to take action to prevent suicide, ideally through a comprehensive national suicide prevention strategy. Government and communities can contribute to the suicide prevention by implementing Live Life World Health Organization's approach to start suicide prevention so that countries can build on it further to develop a comprehensive national suicide prevention strategy. The guide is for all countries with or without a national suicide prevention strategy. National or local focal points for suicide prevention, mental health, alcohol, or NCDs, and community stakeholders with a vested interest or who may already be engaged in implementing suicide prevention activities. So this guide, Live Life, an implementation guide for suicide prevention in countries, is a very good resource. And another resource, Preventing Suicide by Phasing Out Highly Hazardous Pesticides. Self-poisoning with pesticides is among the most common means of suicide worldwide, particularly in low and middle income countries where highly hazardous pesticides, HHPs, are readily available. Multi-sectorial action is needed to phase out the use of HHPs to prevent suicide and other related issues of public health and environmental concern. So this brochure, Preventing Suicide by Phasing Out Highly Hazardous Pesticides, aims to provide a brief overview on the issue of HHPs and approaches to phasing out of HHPs to save lives, particularly suicides. It has been designed for a broad audience, including policymakers, example, health, agriculture, and environment, pesticide regulations, local health and agriculture services, civil society organizations, academicians, as well as the general public. It draws on the 2023 World Health Organization FAO guidance on use of pesticide regulation to prevent suicide and the 2019 World Health Organization FAO publication Preventing Suicide. Another resource, Preventing Suicide, a resource for media professionals, update 2023, is based on the evidence that media reports about suicide can enhance or weaken suicide prevention efforts. Widely disseminated stories of death by suicide are often followed by more suicides in the population. While stories of overcoming a suicidal crisis can lead to fewer suicides, media professionals are encouraged to focus on presenting stories of people who overcome difficulties following a suicidal crisis while also following the do's and don'ts in this resource when reporting on suicide. Previous versions have been updated in this resource, in particular in the areas of proactive reporting on stories of survival and suicide prevention. Positive impacts of reporting on suicide prevention, hope and recovery, and specific considerations for online, digital, and social media. The primary audience for this resource comprises professionals working directly in media, such as journalists, news directors, editors, The primary audience for this resource comprises professionals working directly with media, such as journalists, news directors, editors, copy editors, photographers, and videographers, as well as journalism schools. More broadly, it is addressed to all other stakeholders who communicate and message or speak publicly about suicide and suicide prevention. Another resource, Helping Adolescents Thrive Toolkit, as the strategies to promote and protect adolescent mental health and reduce self harm and other risk behaviors. This publication, produced by the World Health Organization and UNICEF, has been developed to support the implementation of the World Health Guidelines on mental health, promotive and prevention interventions for adolescents, released in 2020. The toolkit includes a core set of evidence informed strategies to promote and protect adolescent mental health. These strategies focus on the implementation and enforcement of laws and policies, environmentalists to promote and protect adolescent mental health, the provision of support to parents and other caregivers, and psychological interventions. This publication, produced by the World Health Organization and UNICEF, has been developed to support the implementation of World Health Guidelines on mental health, promotive, and preventive intervention for adolescents, released in 2020. The toolkit includes a core set of evidence informed strategies to promote and protect adolescent mental health. These strategies focus on the implementation and enforcement of laws and policies, environments to promote and protect adolescent mental health, the provision of support to parents and other caregivers, and psychosocial events. Another resource, MH Gap Intervention Guide version 2.0 for mental, neurological, and substance use disorders in non specialized health settings. This is a second edition of second version in 2016 of the MH Gap Intervention Guide, MH Gap IG for mental, neurological, and substance use. It is for the use of doctors, nurses, other health workers, as well as health planners and managers. The intervention guide presents the integrated management of priority MNS conditions using algorithms for classical decision making. This update of the 2010 edition is also based on new evidence as well as extensive feedback and recommendations from experts in all World Health Organization regions who have used in MH Gap IG version 1.0. So the Live Life Initiative for Suicide Prevention, each year more than 8 lakh people end their own life. Each death is a tragedy with far-reaching impact on families, friends, and communities. Much can be done to prevent suicide at the individual, community, and national levels. Live Life is an World Health Organization initiative to support countries to advance political will, national strategic action, and serve as a catalyst for the Live Life Implementation Guide, developed as part of this initiative, provides a technical guidance for the delivery of 4 key evidence and evidence-based multi-sectorial interventions and 6 cross-cutting foundational pillars for suicide prevention. These are limited access to means of suicide, interact with media for responsible reporting of suicide, foster socio-emotional life skills in young people, early identification and support for everyone affected by the suicide and self-harm. So the Live Life intervention can be integrated into health, community, and other settings and function as a starting point to build a multi-level, multi-sectorial approach to suicide prevention. And there are also various resources like Live Life, an implementation guide for suicide prevention in countries, which was released on 17th June 2021, a National Suicide Prevention Strategic Progress, Examples and Indicators, released on 30th November 2018, and World Health Organization Policy Brief on the Health Aspects of Discriminalization of Suicide and Suicide Attempts, released on 12th September 2023. Practice Manual for Establishing and Maintaining Surveillance Systems for Suicide Attempts and Self-Harm, released on 13 June 2016, and Preventing Suicide, a Community Engagement Toolkit. Released on 24 June 2019, and Preventing Suicide, a Resource for Media Professionals, update 2023, released on 12 September 23, can be used effectively for suicide prevention awareness and also in understanding and formulating implementing strategies. These are various resources which you can use Kindly go through these resources. If you need these resources, you can just let me know. I will be sending you these resources, and they can also be found on World Health Organization or United Nations website. So these are official resources. We should always refer to authentic and official resources. Okay, we will quickly move on. Though there is a lot of information that can be shared due to time constraints. We'll just briefly look into it. So, as we have seen that suicide is a major public health problem with far-reaching social, emotional, and economic consequences. And we know that each suicide profoundly affects many more people. Suicide remains a critical global issue affecting individuals and communities worldwide. Changing the narrative on suicide aims to inspire individuals, communities, organizations, and governments to engage in open and honest discussions about suicide and suicidal behavior. By initiating these vital conversations, we can break down barriers, raise awareness, and create better cultures of understanding and support. Every nation, every community, and every individual is at different stages in their understanding and awareness of suicide prevention. No matter where you stand, and there are many ways to be involved in World Suicide Prevention Day. There are a range of activities and resources to ensure everyone can participate meaningfully, whether you are just beginning to learn about suicide prevention or are deeply involved in advocacy. There are ample opportunities for you to contribute and support this vital cause. By addressing various areas like for individuals, for communities, for organizations, for governments, and working collaboratively across sectors, we can create a more supportive and compassionate society where suicide is preventable and everyone feels valued and understood. And start the conversation today. Every conversation, no matter how small, contributes to the more supportive and understanding society. Together, we can make a difference and work towards a future where suicide prevention is prioritized and everyone feels supported to get the help works for them. The theme for 2024 World Suicide Prevention Day, Changing the Narrative on Suicide, the theme identified for 2024 till 2026. This is by annual theme for 2 years is changing the narrative on suicide with an associated call to action of start the conversation. So, changing the narrative on suicide is about transforming how we perceive this complex issue. It's about shifting from a culture of silence and lack of understanding to one of the openness, empathy, and support. Changing the narrative on suicide aims to inspire individuals, communities, organizations, and governments to engage in open and honest discussions about suicide and suicidal behavior. By initiating these vital conversations, we can break down barriers, raise awareness, and create better cultures of understanding and support. Changing the narrative requires systematic change. It means advocating for multi-sectorial policies that prioritize mental health, increase access to care, and provide support for those in need. It means investigating in research to better understanding the complexities of suicide and develop evidence-based interventions. Changing the narrative means fostering empathy and compassion for those who are struggling. It means understanding that suicidal thoughts and feelings are a sign of immense pain and distress. But talking about suicidal thoughts does not increase their presence or occurrence. It means listening without judgment, offering support, and guiding individuals towards help. So, we all acknowledge that an increased focus on the issue of suicide can be overwhelming for those with a lived or living experience of suicide. It's crucial to recognize that World Suicide Prevention Day is a day dedicated to raising awareness, fostering change, and providing a supportive sense of community and understanding for those who live or living experiences. Every nation, community, and individual is at different stages in their understanding and awareness of suicide prevention. No matter where you stand, there are many ways to be involved in World Suicide Prevention Day. With a range of activities and resources to ensure everyone can participate meaningfully, whether you are just beginning to learn about suicide prevention or deeply involved in advocacy, there are So finally, before we conclude, there is also a helpline, suicidal crisis support. Find a helpline where you can search for the helplines across the world. So I'll be sharing you the website address in the chat box. It's a find a helpline. Where you can use this, always keep this with you and share whoever requires. And you can also search for helplines even in India and abroad. So you can visit this website and you can search for the helplines. So before taking up presentations, and I shall conclude this. So if you are in suicidal crisis, now what is that we can do? Or you can do? If you are feeling suicidal, you are not alone. And there is a support available. You deserve to feel supported. Experiencing thoughts of suicidal self-harm is very distressing. If you are considering suicide or self-harm or are in danger, please call your local emergency services immediately to ensure your safety. So talking about how you are feeling could help elevate some of your distress. You might want to talk to someone close to you, or if you prefer, you could speak to volunteers who have been trained to listen by contacting a helpline. Many services offer a range of mediums such as chat, text, email, calls, or face to face. It is also important to recognize the value of seeing a mental health professional. They can provide you with a range of interventions and supports on a more long term basis. Some people find it helpful to create a safety plan, which is a tool developed for helping someone navigate through suicidal feelings and urges. And also look for a friend, family member, or neighbor, or someone who is trustworthy, where you can share and work on prevention of suicidal thoughts and address the factors that is contributing to those thoughts. And supporting, if you are looking to support someone in a suicidal crisis, there are ways in which you can show that you care by reaching in and supporting someone in suicidal crisis. When a person tells you that they are suicidal, you must take them seriously. If you are worried that somebody is suicidal, you can ask them if you feel comfortable doing so. Research shows that talking to someone openly about suicide does not increase their risk of suicide. If you are comfortable speaking with them about suicide, try to use clear and direct language. For example, I care a lot about you. Do you feel suicidal? People with lived experience of suicide highlight how helpful it is to have someone to talk to who listens. That's why often it is very important, no matter whether you will be able to help him or her or not, doesn't matter. But they are looking for a ear, hearing ear. They are looking for a lending hand. They are looking for a lending arm to lean on for the support. So just be with them till the time passes so that you can discuss on that and try to address it. If you are worried that somebody is suicidal, you can ask them if you feel comfortable doing so. If you are comfortable speaking to them, talk about them, discuss the factors that are contributing to them, and also discuss how to postpone it immediately so that the present risk is resolved, and also try to work on a schedule. And if possible, if it is not within your scope, you can also consult a counselor, a psychologist, a psychiatrist, or a mental health professional. People with lived experience of suicide highlight how helpful it is to have someone to talk to who listens. That's why it is not about coming up with solutions, but about listening to the person and supporting them explore options for seeking help and safety. It is important to encourage help seeking behavior and linking to professional support. You can help the person you are supporting by being there for them when they call a helpline or make an appointment with a health professional. It is also of critical that you look after your own mental health and well-being and seek support of your own. So now we will move, we'll check for any presenters available. We see good number of presenters registered. If you are there in the platform, you share your details. In the chat box. Lakshmi, are you there? Ready for your presentation? You can open your PPT. Keep it ready. Connect Zoom in both the devices. And also let us know from which device you are sharing your PPT. so that we can provide option for that device as well. You can text from that device as well, because for both the devices you will require permission. Have you logged in? You can unmute yourself. Start your video. Okay, both the devices have been granted permission. You can quickly unmute yourself, start your video and share your PPT. Quickly do, ma. We are running out of time. So the certificates for 15th, which we have organized the international conference on suicide prevention. On the same day, we have announced that there will be another day, that is on 30th September. So today we are having these sessions. So the certificates for both the days, that is 15th September and 30th September, will be released in a week's time. So you can check the website link for both the days to download your certificates if you have registered and provided feedback for whichever days you have presented. If you have attended for both days, you can check for your website for certificate on the website after 3 to 4 working days. Yeah, Lakshmi? Are you presenting, ma? At least unmute yourself and respond. What is the issue you are facing?
Yes, yes, sir, I'm presenting.
Okay, ma, you have to mute one device. On top of the screen, mobile screen, you will see a speaker icon. You can just click on that and you can say mute in one of the devices. If you mute both the devices, you will not be able to hear. But if both devices speaker is on, then you will hear an echo. Everyone will hear an echo, as just now we heard. That's why you have to mute one of the device speaker. Yeah, your PPT is visible. You have to unmute yourself in other device and start your video from other mobile which you are going to speak.
So, good evening. So, my topic is on suicide prevention.
You have to mute my other mobile, so in which you are sharing the PPT, na? You have to mute that speaker.
So, first, our introduction part. Suicide's not, it's like what association psychology social. Suicides mainly come from their emotional
Introduce
impact.
yourself, ma, first. To the participants, introduce yourself and your topic, then go into the presentation.
Okay, sir, sure. So myself, Kriba Lakshmi from Ratana Arts and Science College, Coimbatore. So my topics on presentation is suicide prevention. So first we go with the introduction part. Suicide prevention is nothing but their emotional impacts, we can say. Yeah, it's maybe like their physical health or mental health, which they can affect that. So we can give them awareness like what they are facing the problem before attending that suicide. We can tell them that we can face the challenges. These are the introduction part from what I said here. Then next come from definition. It's suicide is a collective efforts aimed at reducing risk suicide by identifying a risk individuals. For here they says that what are the individual facing the risk. Should it's maybe the behavior, it's maybe the emotions, whatever maybe we should face it. That's here come definitions. So next, here are the key concept, that is risk factor identification, productive factors, early intervention, awareness and education, screening and assessment, assess to care, productivation support, community and social support, crisis intervention. Here, risk factor identification is we should identify the risk factors. Second, productive factors. Productive factors, how we can protect that individual from that suicidal thoughts. Early intervention means that what all the intervention we can give for that individual. Awareness and education means that we shall provide their awareness about their life and what all the backfire that they will lead for their life. We have so many screening and assessment, so we can use that also, how much levels they have that suicidal thoughts. Access to care, na, we should be take care of that individuals. Pro- pro- Motivation support means that how we can by support the family, environment and social. Community and social support, same like that, how the community can support their individual from the suicidal thoughts. Crisis intervention means we will say that before precaution is better than cure. That is a crisis intervention comes. Impact of suicide prevention. Suicide prevention program, increased awareness and education, effective strategy in suicide prevention, training program, community and governmental support, challenge and further decision. Thank you.
Congratulations, ma. You switch on your video so that we can take your screenshot also. You go to your first slide on which you have your name and title. Keep your video on. Okay. Wait for a second. Okay, congratulations, ma. Wishing you all the success. Complete the formalities for presenters so that you will be eligible for the certificate.
Thank you, sir.
And participants, if you have any queries regarding anything related to suicide prevention, you can feel free to use chat box to share, or you can raise your hand so that we can unmute yourself so that you can ask your queries. Regarding certificates, see, all the certificates will be available on the website for those who have completed the formalities. Regarding the formalities, you need to check website. Yeah, you can stop video, ma, and you can stop sharing as well. You can mute yourself. I'll be sharing you the link also. We are not sending any certificate to your email ID. You need to visit the website and download the certificate from the website. We'll share you the details from where you can download your certificates if you are eligible, if you are completing all the formalities. Now we will also share. So this is today's event. Every event has a dedicated page. Website will be same, but every event will have its own web page. So you need to check in that respective page for that respective event certificate. So we are sharing the feedback form. Those request everyone to quickly fill up the feedback form before you leave the platform. It is mandatory for filling up the registration form and feedback form along with attendance to be eligible for the certificate. And presenters need to share your PPT along with that before immediately after registration. So if you have not shared your details, kindly go through the presentation details where you have all the instructions step by step. If you have not completed, kindly complete in your better interest. If you are not completing, you will not be issued certificate. So that's why we request everyone to attend, keep attending, and also keep completing your formalities in time. And if we have any other queries related to subject, feel free to ask in chat box. We are happy to take it up. Then share your feedback, suggestions, comments in the chat box, or you can raise your hand. So the certificates for both the days, that is 15th September and 30th September. Today, both certificates will be released at once after within 3 to 4 working days. So those who have already registered for that event, you need to check. The registration form is same for both the events, but the website address will be different. This is for 30th, and I will also try to share for 15th. Everything is there on the website, and when you register, you are also getting an email of your registration copy. In that also, you will have website address. So this is for 15th September. Same, the link, in that link, instead of 15, you can type 30 and you will reach that event's website. So both the events, you complete the formalities, those who have not completed. And tomorrow, there is another event that is being organized. For that, the joining link is different. So we request you to check our group, Facebook and WhatsApp groups. There is one event organized by Department of Linguistics, Osmania University, tomorrow. Though it is on the same platform, we are supporting technically for organizing. So you can use, there is a different ID and password. So you can join our social media, Facebook group or any other platforms where we have shared. You can join it. The program is held from 4 to 5:45 in the evening. And then there is also coming up events on October 5th, which is World Teachers Day. So you can, there is no limit and there is no specific criteria. You can also apply for awards, nominations. And last month on September 5th, we have also organized Teachers' Day celebrations on September 5th. So similar way, this October 5th, also we are organizing World Teachers' Day. That was National Teachers' Day, and this is World International Teachers' Day. So you can make your, there is no presentations as such, but if you are willing to make presentation, technical or scientific presentations, you are welcome. Otherwise, you can register and you can address and that is the exclusive event dedicated to honor our teachers, academicians, professors, in the memory of our teachers. And the theme for this year, World Teachers' Day, is valuing teachers' voices, which is commemorated and by UNICEF, basically, and we all are celebrating. So on this day, you can nominate yourself. It is also having free registration as every event and free nominations and presentations, participation, certificate, everything is free. And And you can also collaborate if your institution or organization is willing to collaborate with us. That is also free. So you can register yourself and you can share your experiences, basically as a teacher, as a professor, how you have contributed. It should not be like a promotion or an advertisement or a self-boosting, a self-booster, but in general, in more of objective, like how in general you have been contributing. Yeah, or you can take up one topic and you can speak on that. So basically, this is not to give again some work or some task on that, but basically to involve all the teachers, professors, so that they can be honored on this platform. So like last month, we have given participation certificates to everyone, but the award certificates, they have to be issued. We thought both together we'll be issuing. So October 5th event, after October 5th event, we'll be issuing award certificates to both the 5th September event as well as 5th October event. So spread this message. This is available on the website. You can visit our website and share with all the teachers, professors across the world. There is no restriction. And if you are a student researcher also, you can register for participation and nominate teachers as well on behalf of them. The website address has been already shared in the chat box. So this is a general address. I mean, the home page from where you need to navigate to respective events. So you can check our website. All the events are there. And on the main page, home page itself, you will find this October 5th, Teachers' Day. You can nominate yourself or your colleagues, or you can ask them, and you can join and share your thoughts, views. And all those who are joining, who are presenting, will get the presentation certificates. And those who are participating will get the participation certificates. And the feedback form for today's event has been shared in the form of polls. We request everyone to quickly fill up the feedback form before leaving the platform. So see you all tomorrow at the same time at 6 o'clock with the same joining link for international webinar series that is being organized daily. In that also, you can participate daily and make presentations and share your knowledge to all the participants. So thank you, everyone. We appreciate all the speakers and the presenters and also the participants. Without your support, this event couldn't have been successful. We thank each and everyone for your valuable time and patience for joining us and being part of this suicide prevention program. Hope you will have a lot of takeaways from this so that we all can at least prevent one suicide in our lifetime. So thank you once again, everyone. See you all tomorrow. Take care. Good night.